Turning 70 is an incredible milestone, but it also comes with new responsibilities, especially when it comes to health. Many seniors assume that aches, fatigue, or forgetfulness are just normal aging, but the truth is that some of these changes can be warning signs of serious health issues. Recognizing these early can make the difference between maintaining independence or facing avoidable complications. Today, we're going to explore 5 warning signs every senior should know after 70, backed by scientific research and real-life experiences from seniors across the United States. Let's start with a simple truth. After 70, your body communicates constantly. Every ache, every sudden change in mood or energy, every drop in appetite or weight is a signal. According to the National Institute on Aging, early detection of health issues in older adults dramatically improves outcomes, allowing timely interventions and preventing small problems from becoming major ones. Yet many seniors, or their families, tend to overlook these signs, dismissing them as just getting old. Consider the story of Mr. George from Chicago, Illinois, who noticed that he was more tired than usual after simple tasks like grocery shopping or climbing stairs. At first, he thought it was normal aging. However, after a routine checkup, his doctor discovered early signs of heart disease. Because he acted early, George was able to adjust his diet, start a tailored exercise plan, and begin medication that dramatically improved his heart health. Without paying attention to that first subtle sign, the consequences could have been far more serious. This video isn't about fear, it's about empowerment. It's about helping seniors and their families understand which changes are worth investigating, and why staying alert can help maintain independence, quality of life, and peace of mind. Each warning sign we'll discuss is supported by research and illustrated through real experiences, making it easier to see how these signs appear in everyday life. By the end of this video, you'll be equipped to recognize potential red flags in yourself or loved ones, take action before things worsen, and have informed conversations with your doctor. Health after 70 doesn't have to be a guessing game. With knowledge, vigilance, and proactive care, seniors can continue to live full, independent, and vibrant lives. So, stay with me as we uncover these 5 critical warning signs. Each one carries essential insights, practical advice, and lessons from people who have faced these issues head-on. Some may surprise you, and others may feel familiar, but all of them are crucial to maintaining your health and independence after 70. Warning sign 1: Unexplained fatigue. One of the most common but often overlooked warning signs in seniors over 70 is unexplained fatigue. Feeling tired from time to time is normal, but persistent exhaustion, even after adequate rest, can indicate underlying health issues that require attention. According to a study published in the Journal of the American Geriatric Society, chronic fatigue in older adults can be an early indicator of cardiovascular problems, anemia, thyroid disorders, or even early-stage diabetes. The mechanism behind this is simple. As the body ages, energy metabolism can become less efficient, but sudden or persistent drops in energy often point to systemic health problems. For example, insufficient oxygen delivery due to heart or lung issues can make even light activities feel exhausting. Similarly, low iron levels or nutrient deficiencies may cause fatigue and weakness, and if left unaddressed, these can lead to serious complications. Real-life experiences highlight just how subtle yet critical this warning sign can be. Take Mrs. Patricia from Phoenix, Arizona, age 73, who began noticing that simple tasks, like walking to the mailbox or cooking a meal, left her unusually drained. At first, she assumed it was just aging. However, during a routine checkup, her physician discovered early-stage anemia caused by vitamin B12 deficiency. By addressing it with diet changes and supplementation, Patricia regained her energy and avoided more serious health issues. She recalls, "I thought getting older just meant being tired all the time, but it turns out my body was trying to tell me something important. Listening to it made all the difference." It's important to note that fatigue can also be a symptom of mental health conditions, such as depression or anxiety, which are surprisingly common in seniors. The National Institute of Mental Health reports that older adults who live alone are at risk of feeling isolated, which can amplify fatigue and reduce motivation. In such cases, addressing social and emotional well-being is just as critical as addressing physical health. Medical professionals emphasize that tracking energy levels daily can be an effective preventive measure. Keeping a journal of fatigue patterns, noting times of day when exhaustion is worst, and recording activities and diet can help doctors identify underlying causes. By paying attention to subtle changes, seniors can often catch problems early, long before they become urgent. In summary, unexplained fatigue is more than just feeling sleepy, it's your body's way of signaling that something may be off. Seniors who recognize this warning sign and seek evaluation promptly often experience better outcomes and maintain their independence longer. As we continue, we'll uncover additional warning signs that are equally critical for seniors to recognize and act upon. Warning sign 2: Cognitive changes and memory lapses. The second warning sign seniors over 70 should watch closely is noticeable cognitive changes or memory lapses. While occasional forgetfulness can be a normal part of aging, persistent confusion, trouble finding words, or difficulty managing everyday tasks may signal early cognitive decline or conditions such as mild cognitive impairment, MCI, or dementia. According to the Alzheimer's Association, roughly 1 in 9 people over age 65 show signs of Alzheimer's disease, and early detection is critical for intervention. Scientific studies reveal that even subtle memory changes can be predictive. A 2021 study in the Journal of Neurology found that seniors who notice increased forgetfulness, misplacing items frequently, or struggling with daily routines are more likely to benefit from cognitive assessments and early therapeutic strategies. Early intervention can slow progression, improve quality of life, and help seniors maintain independence for longer. Consider the experience of Mr. Henry from Seattle, Washington, age 76. His family began noticing that he occasionally forgot appointments or repeated questions multiple times during conversations. Initially, Henry dismissed it as senior moments. But after his daughter encouraged him to see his doctor, he was diagnosed with mild cognitive impairment. With proper treatment, lifestyle adjustments, and cognitive exercises like puzzles and memory games, Henry was able to stay independent and actively engaged in his community. He shared, "I never thought forgetting small things could be serious, but getting help early made a huge difference. I feel sharper and more confident now." Mental stimulation, physical activity, and social engagement all play a role in maintaining cognitive health. A study from the University of California, Los Angeles, UCLA, found that seniors who remain socially active, read regularly, and participate in problem-solving tasks experience slower rates of cognitive decline than those who are less engaged. Nutrition also matters. Diets rich in fruits, vegetables, and omega-3 fatty acids support brain function. It's important for seniors and caregivers to track changes over time. Keep a journal of memory lapses, note patterns, and share observations with a healthcare provider. Early recognition empowers seniors to take proactive steps, from medical evaluation to lifestyle adjustments, long before serious decline occurs. Now, before we continue, I want to see who's paying attention. If you're still following along, type number 2 in the comments below. That way, we'll know you're serious about protecting cognitive health. And remember, this is just the second warning sign. 3 more crucial signs are coming that you won't want to miss. Warning sign 3: Sudden weight loss or poor nutrition. The third warning sign that seniors over 70 should monitor closely is unexpected weight loss or signs of poor nutrition. While a small drop in weight may seem harmless, unexplained changes can indicate underlying health issues, such as digestive disorders, thyroid problems, or even early signs of cancer. According to the National Institute on Aging, unintentional weight loss in older adults is linked to increased risk of frailty, muscle loss, and hospitalization. Nutrition plays a critical role in maintaining strength, immunity, and overall health in later years. Seniors who lose weight unintentionally often experience decreased energy levels, reduced muscle mass, and weakened bones, which can lead to falls and fractures. Malnutrition can also exacerbate chronic conditions like diabetes, heart disease, and hypertension. Take Mrs. Gloria from Atlanta, Georgia, age 75, as an example. Over 6 months, her family noticed she had lost several pounds without dieting. She seemed more tired than usual and had less interest in cooking or eating. Concerned, her doctor performed a series of tests and discovered she had early-stage digestive issues that were affecting nutrient absorption. With dietary adjustments, supplements, and meal planning support, Gloria regained her weight and energy, allowing her to maintain her independence. She recalls, "I thought losing weight was just a part of getting older. I never realized it was my body asking for help." Scientific evidence underscores the importance of monitoring diet and weight. Research from Harvard Medical School highlights that older adults should have balanced meals with adequate protein, healthy fats, and fiber, and maintain regular eating habits. Even minor changes in appetite, skipping meals, or avoiding foods that were once enjoyable can signal the need for evaluation. Additionally, seniors living alone may be at higher risk for poor nutrition due to social isolation, limited mobility, or difficulty preparing meals. A study in the Journal of Nutrition in Gerontology and Geriatrics found that seniors who live alone are more likely to skip meals or consume less nutrient-dense food, which can accelerate health decline. By paying attention to sudden weight loss, changes in appetite, and signs of poor nutrition, seniors and their families can take proactive steps. This may include consulting a healthcare provider, adjusting diet, or seeking support for grocery shopping and meal preparation. Early intervention not only preserves physical health but also maintains energy, strength, and quality of life. In summary, unexpected weight loss or nutritional decline is a serious warning sign that should never be ignored. Recognizing it early allows seniors to address potential health issues, maintain independence, and continue living an active. Warning sign 4, balance issues and increased falls. The fourth warning sign seniors over 70 should never ignore is balance problems and a higher frequency of falls. While occasional stumbles may seem minor, repeated incidents or difficulty maintaining stability can indicate underlying health concerns such as muscle weakness, neuropathy, inner ear disorders, or medication side effects. According to the Centers for Disease Control and Prevention, CDC, 1 in 4 adults aged 65 and older falls each year, and falls are the leading cause of injury-related hospitalization in older adults. Research has shown that declining balance and frequent falls are not just accidents, they are often early indicators of frailty or progressive medical conditions. A 2020 study in the Journal of Geriatric Physical Therapy found that seniors who reported unsteady walking or frequent near falls were at significantly higher risk of fractures, mobility loss, and reduced independence. Identifying and addressing these warning signs early can prevent serious injuries and maintain overall quality of life. Consider the experience of Mr. Leonard from Minneapolis, Minnesota, age 78. Over several months, he noticed that getting out of bed or stepping off a curb felt more precarious than before. One morning, he tripped slightly in his kitchen but didn't fall, an event he almost ignored. After mentioning it to his doctor during a routine checkup, he discovered early-stage peripheral neuropathy, which affects balance. His physician recommended targeted exercises, a physical therapy program, and minor home modifications, such as non-slip mats and grab bars. Leonard said, "I didn't realize that almost falling was a warning sign. Now I feel safer and stronger because I acted early." Physical activity is crucial in preventing balance problems. The National Institute on Aging emphasizes that strength training, balance exercises, and walking routines can reduce the risk of falls by improving muscle tone, joint stability, and coordination. Even simple exercises like heel raises, leg lifts, or yoga can make a significant difference in maintaining stability. Medication management is another critical factor. Some prescriptions, particularly those for blood pressure, pain, or sleep, can cause dizziness or unsteadiness. Seniors and caregivers should routinely review medications with their healthcare providers to minimize these risks. Now, if you're still watching and paying close attention, type number 4 in the comments below. It shows you understand how crucial balance and fall prevention are for seniors over 70. Remember, this is just the 4th warning sign. There's one more we'll cover that is just as important, and it could be something you or a loved one may be experiencing without realizing its significance. Warning sign 5, shortness of breath and reduced stamina. The 5th warning sign that seniors over 70 should be alert to is shortness of breath or a noticeable decrease in stamina. While some decrease in endurance is expected with age, sudden or persistent difficulty breathing during everyday activities, like climbing stairs, walking to the mailbox, or performing light household chores, can indicate serious conditions such as heart disease, chronic obstructive pulmonary disease, COPD, or other respiratory or cardiovascular problems. According to the American Heart Association, dyspnea, shortness of breath, in seniors is a common early indicator of cardiovascular complications, including heart failure and arrhythmias. Additionally, a 2019 study in the Journal of Geriatric Cardiology found that older adults who reported a significant drop in exercise tolerance often had underlying heart or lung conditions that had not yet been diagnosed. Recognizing this early allows for timely interventions that can prevent serious complications, hospitalization, or decreased independence. A real-life example comes from Mrs. Janet from Boston, Massachusetts, age 74. She noticed that she became winded after short walks and struggled to keep up with her usual grocery routine. Initially, she thought it was normal aging. But after discussing her symptoms with her physician, she was diagnosed with mild congestive heart failure. With a treatment plan including medication, dietary adjustments, and a supervised walking program, Janet regained much of her energy and mobility. She shared, "I didn't think being out of breath was serious, but getting help early changed everything. Now I can enjoy my days without feeling trapped by fatigue." Exercise and physical activity are critical in both prevention and management. The National Institute on Aging recommends regular aerobic activity, such as walking, swimming, or low-impact cycling, which strengthens the heart and lungs while improving stamina. Even moderate activity done consistently can help seniors maintain independence and reduce the progression of cardiovascular or respiratory conditions. It's also important to consider the combined effect of multiple health factors. Shortness of breath can be exacerbated by anemia, obesity, or poor nutrition, which makes monitoring overall health even more essential. Seniors should keep track of changes in endurance, report them to their healthcare providers, and undergo regular screenings for heart and lung function. In summary, reduced stamina or shortness of breath is not merely a sign of getting older, it's a critical warning signal that should prompt evaluation. By recognizing it early, seniors can maintain mobility, energy, and independence, while addressing underlying conditions before they escalate. This fifth sign completes the essential checklist of warning indicators for those over 70, helping seniors take control of their health proactively. Final conclusion. Now that we've explored all 5 warning signs, unexplained fatigue, cognitive changes, sudden weight loss or poor nutrition, balance issues, and shortness of breath, it's clear that being proactive about health after 70 is not optional, it's essential. Recognizing these signs early can make a dramatic difference in maintaining independence, preventing serious complications, and improving quality of life. Knowledge truly is power, and paying attention to your body can be life-saving. The stories of seniors like Mr. George from Chicago, Mrs. Patricia from Phoenix, Mrs. Gloria from Atlanta, Mr. Leonard from Minneapolis, and Mrs. Janet from Boston highlight how real people take action when they notice subtle changes in their bodies. Each one demonstrates that early recognition, combined with medical guidance and lifestyle adjustments, can prevent small issues from becoming major health crises. Their experiences are proof that seniors can live full, active, and vibrant lives well beyond 70, as long as they listen to their bodies and act promptly. Scientific research consistently supports this proactive approach. Studies from institutions such as the National Institute on Aging, the CDC, and the American Heart Association emphasize that early intervention dramatically improves outcomes in older adults. By monitoring energy levels, cognitive function, nutrition, balance, and stamina, seniors not only protect their health but also preserve independence, confidence, and self-esteem. These warning signs are not to create fear, they are tools that empower seniors to make informed decisions and maintain control over their health. It's also worth noting that awareness benefits not just the individual, but their families and caregivers. Observing these signs early allows families to provide timely support and encourage medical evaluation, helping seniors avoid preventable hospitalizations and maintain a high quality of life. Small changes, like adjusting diet, incorporating physical activity, or scheduling regular checkups, can create significant long-term benefits. Ultimately, aging doesn't have to mean decline or loss of autonomy. By paying attention to these 5 critical warning signs, seniors can take charge of their health, reduce risks, and continue to live meaningful, independent lives. Remember, your body communicates constantly, it's up to you to listen. If you found this video valuable and want to continue empowering yourself or your loved ones, please like this video, subscribe to our channel Golden Age Wisdom, and share it with friends and family. Doing so helps us continue sharing crucial health insights, inspiring stories, and practical advice for seniors who want to thrive after 70. Your health and independence are priceless, and these 5 warning signs are your early alert system. Pay attention, act early, and embrace each day with confidence. After all, growing older doesn't mean giving up, it means learning, adapting, and living life wisely. Stay informed, stay strong, and remember, you have the power to take control of your health at every age.